Hello, everybody. Thank you for joining. Hi, everyone. Thanks for joining. Just inviting our guest today.
Hello. Hello. How are you?
Hello. How are you?
I'm good. I'm good. Talk to me.
Yeah.
I'm.
So
I
thank you
am.
for.
I am looking forward. I really am looking forward to attending. Yeah. Good.
Excellent. So I wonder, Eddie, if we can start off, if we give a little introduction to who we are, and then you do the same, and then I'll ask you some questions about the conference. Is that okay?
I want you to introduce. So talk to me, public, because I need to know what the reason. So look, I keep getting asked to do so many different things, but public health. What you guys told me made perfect sense. You're trying to educate people about the importance of food, and I know you're a parent as well, you know. And I just said that's what got me. That's why I
Yep.
decided to do this. Talk to me.
So I will. So, hi everyone. We are the Public Health Collaboration. My name is Olivia Quadri. I'm one of the trustees at the charity, and we are a UK-based charity that is all about helping people understand the power of metabolic health and trying to inspire and educate people to eat better. So very, very much the same ambitions that you have,
Absolutely.
Eddie. We're a group
Yes.
of public and also many doctors that have
Yes.
decided that we need to make a change, and we are trying to start a grassroots movement so that people can support us and we can make the change to help educate healthcare professionals and the public about how to eat and what better nutrition looks like. And so a lot of what we're doing is education, but a lot of what we're doing as well is changing the system. So we have a program where we're going to the NHS and we're saying, NHS, if you have people who are pre-diabetic or diabetic, we will coach them.
Yes.
We will help them manage that diabetes. So we will help them put it into remission. So we've put many people have reversed their type 2 diabetes through our program, and that's changing it with the NHS. So it's changing it in the main system.
But sorry, is it Olivia? Is it possible to change the nurses' attitudes as well? The health professionals, because they're the ones who I've had the most pushback with. Because I'm telling my clients, and they're reversing their type 2 diabetes, and they're going into wards, and then they be a hospital. They're being told, "Oh no, you should eat like this, you should eat like that."
Yeah, absolutely. So everyone that we're trying to educate is the public and the healthcare professionals.
Yes.
So a lot of people who support us, in fact, most people who support us are from the NHS, because
absolutely
the people who set this charity up are doctors from the NHS, and so they've brought a lot of people from the NHS with them. And so the more we can grow, the more we will bring people along from that community, from the healthcare professional community as well, who are so important that we have to make sure they're educated, as well as the public too. So we are absolutely about educating both those people, both those sets of people, right?
That really makes me happy. That's what you see, because I'm just sitting there by myself. You know, when people like I know there are people like Anthony Chaffee and you got Ken Berry are going to be talking, and these are the guys that they gave me the. And I mean, I know obviously what's his name, Chris Van Talican, with his book, because I've been preaching this for a while. When I saw the book, I'm like, so I'm not on my own. And then now I'm seeing that these people are going to be on the panel, and I'm so looking forward to meeting them.
Yeah.
Because I learned a lot from these guys.
Yeah. And just to go back as well, I mean, what we are hoping to do as a charity is to bring all of these amazing people together, like yourself and all of those educators, so that everyone has a forum and a place to come together and support this movement, because there's so many people like yourself that are doing it separately. And actually, if we bring together all this effort and use the power of community, we can actually make a difference, especially from a grassroots point of view. So that's why, as a charity, we're doing these programs with, like the one I mentioned in the NHS. We're helping people reverse food addiction. We have another program for that. We have a program where we're going into schools now. We're piloting changing an education module so that kids can actually learn how to read food labels, how to play games and be food detectors, and be interested in what they're eating and the power of what they're eating. So
Bring back cooking at school. Bring back, when I was young, when I was at school, we learned to cook. It was part of the curriculum. We had
Yeah,
to learn how to make certain dishes, single ingredient foods. None of this, now all that has been lost. And I think it's an empowering thing learning to cook.
it is. Yeah, and I think kids need to hear it, from people like you on social media, which is so powerful. But also they need to hear it
Yes,
in their ears from school as
mainstream.
well.
Yeah,
Because at school they have a very different environment.
yeah.
A lot of the food that's given to kids in schools is not
It's not
not
food, is it?
adequate.
Yeah.
No, and most of them will walk home with a packet of crisps and eat all kinds of stuff on the way home.
Energy drinks. Yeah.
Yeah. So, we want kids to, maybe they won't listen the first time, but it will plant a seed in their head that will make them think about what they're eating and
I
think
mean,
about what's good and not good.
I mean, my team, there was a lady in my team who's got children, and they're saying that some of the children, they are in their WhatsApp groups, they're sending my videos around because the videos are entertaining. I mean, it's a
Yeah.
character that I play a character, and they're entertaining. They're informative as well, and it's just basic information. It's trying to, and I like that, the fact that the young ones are listening. That's why I refuse to, GMT, Good Morning TV, Sky. But no, I just said no because I want to reach people from the grassroots, which you're trying to do, and I'm really glad you're doing
Thank
that. That's good.
you so much. And what you're doing is amazing to get through to the younger generation. I have kids, as you said, myself, and it's really hard. It's really hard for
Yeah.
them to deal with the peer pressure
Yes.
of other
Yeah.
children that eat differently. They don't want to be different, they want to be normal. If we
Yeah.
can make it normal for
Create
kids to eat the right
normal. That's
things,
it. Yes.
let's make it normal then.
I mean,
Let's make it cool. And
it's
that's what you're
amazing.
doing, Eddie.
I've got university students cooking and sending me pictures of their food. Said to me, Eddie, because of you, and it's cheap as well when you're doing it yourself. And I think it's a skill. I mean, my mum, when I was 10 years old, I was living in the country. Said you got to learn to cook. She taught me 8 dishes, and I taught all my kids, and I still make those 8 dishes. And I think it's important. Cooking is important.
Yeah, absolutely. My kids cook every day themselves. They wake up, they make
Absolutely,
their eggs, they make their breakfast, and when they eat, when they are hungry, that's when they'll eat. They don't have to wait for someone to cook for them. They'll just go and get the food
absolutely.
and they'll make it. And it's a very simple way of eating. It's nutrition. It's what their body needs. And if
Nutrition
kids
is
can do
simple.
that, yeah, there will be very little disease out there
No, but
if
it's
all
true though.
kids started doing that.
If we all knew, I think what upsets me is the fact that the people who matter. When I say people who matter, you know what I'm talking. The politicians, most of them know. I mean, I've got Dolly tells me that most of them see watch my videos. They think it's entertaining, but to get the policy change, I think it's just going to be difficult because it's all about money, isn't it? It's all about
Yeah.
money. But
And
let's keep doing what we're
yeah.
doing.
And I think if people can support, yourself and charities like us,
Yeah.
we won't take funding from any profitable industry. We don't do that, and there's no profit to be made from eating real food. So
That's
a lot
true.
of the
Yeah.
time we are very, very reliant on people supporting
Yeah.
us from the grassroots. That's the
Yeah.
only
Yeah.
support we have. So if people would like to support our cause and our mission and see the change in the system that we need to have, then we're a great charity to support.
Absolutely.
Um,
I'm going to be promoting your charity. I'm going to be promoting your charity because what you're doing is good. I mean, we're trying to educate the young ones. They're the ones that need educating because I've got these young people are telling their parents, sending their parents Eddie's videos, and their parents are like trying some of what I'm making, and it's simple. You see, when you eat like this and you feel better, then you don't want to let it go.
yeah.
That's what, yeah,
That's so true. And I think it's so right. I think kids are now educating their parents,
yeah.
not just on nutrition, but on many things.
And many things like technology, especially.
Yeah.
Yeah, listen, Olivia, that's good. I'm glad you're doing this, and I'm looking forward. Like I said, I'm looking forward to coming to the event.
so,
Yeah, it'd be good.
so tell us what you want to make sure everyone hears when you're at our event, because you're going to be on a panel which is about how do we prevent the next generation encountering all the dangers of ultra processed food. So what
They're
points
like
do you want to make, Eddie?
the point I want to make is the cooking thing. I want everybody to start cooking again like it was when I was a teenager in my 20s when I was a student nurse. The way to get to a girl was to cook for them. But that's when we really met girls. We cooked for them, impressed them, learned different dishes. That art's been gone. It's been lost, and I want to bring that back. I want to educate the young people about the importance of not eating ultra processed foods and how good they will feel if they start eating properly. Because I've got so many testimonials, and I always put them in my Insta story highlights. There's so many of them, thousands. people from all over the world saying, Eddie, I'm eating the simple food you're asking me to eat. And I feel so much better. I'm actually able to study. I've got teenagers sending me testimonials, and that's really good. Just my mom is cooking better food for me because of you. I'm eating eggs every morning, and that's what I want to. I want to just keep educating the young ones. I mean, Piers Morgan wants me on his flipping show, and I would say it because I don't want anything to do with anything mainstream. Not for now. I just want to hit the grassroots because nobody's targeting them. They want to make get excited about, or then they become a flash in the pan, and then no. I want to just keep doing what I'm doing, keep educating people. And eventually we want to be able to go to schools and say, if you eat like this, you will feel like this. So that when they see results, when the kids see the tangible effects of the way they eat, it's going to be good for them. That's how we're going to create change. So yeah.
Yeah. Oh, we're totally aligned with you on all of that. And is there anyone else that you're really looking forward to seeing or hearing at the conference? Because we've got quite a few fantastic, all the
I,
leading metabolic health speakers coming to the UK for this conference
I
in
mean,
May.
I've got to say that too. I'm looking. Dr. Rachel Brown. I mean, I love her stuff, but I think that sometimes the doctors, obviously because they're very well educated, the delivery is lost on the average person who is not saying fucking shit.
Yeah.
That's why I adopted this attitude, because it's not trying to sound intelligent. It's not going to work for me because
Yeah.
it will never work. But their knowledge is just so powerful. Anthony Chaffee, like I mentioned, Ken Berry. These are
Yeah.
people who are also no nonsense like I am. But is it the way, like you said, they're delivering it with a hammer, and I got a sledgehammer, and
Yeah.
and yeah, that works. You know what I
Yeah.
mean?
And they're all very excited to meet you as
Oh,
well.
that's
So
good. Yes.
it's going to be fantastic. And we're also got a couple of big debates happening. So on the Saturday, we have a question that we're all going to talk about that everyone thinks they know. Like, does red meat shorten
Here
your lifespan?
we go. I
And
know.
we've got
I eat red meat
Anthony.
every day.
Yeah, and we've got Anthony Chaffee discussing that in that debate with Ben Bickman, who's a fantastic
Yep,
scientist as
yep,
well.
yep, yeah,
And we've got people with opposing views to that.
yeah,
So then now people can hear both sides of the argument
yeah.
and they can make their own minds up. And then on Sunday, we've got a very similar thing going on with the question, does cholesterol cause heart disease? Because everyone
I
thinks
know.
it does
I
still,
know.
even though that's
Yeah,
been
yeah.
talked
We
about a
debunked a
lot in
long
the
time ago. I
scientific
know.
community. And we have Dave Feldman and some people who are doing some really great work in that field,
Cool.
discussing that with very mainstream, people who work in the science who think that that is the case, that we do need to lower cholesterol for preventing heart disease. So if people want to find out the real answer to these questions that people keep talking about, come along to our conference. You will hear it firsthand from the best experts in the world.
Yes, that's. I mean, the people who want to be convinced. I mean, I suppose I try not to get involved with people who are trying to oppose what I'm saying, because the proof of the pudding is in the eating.
Yeah.
I'm saying
Literally.
yeah, the proof of the meat. I say to them, look, why don't you, instead of just arguing with me, whatever study you see, there's going to be another one that contradicts it. Why don't
Yeah.
you just try what I'm suggesting for about a month before you argue with me? And then usually they try it and they're like, okay, I get it. It's about, because you know how it is.
Yeah.
There's so much, studies and stuff. This a lot of it being paid for by people, and you look at it and it's so confusing. The
No.
average person is in the dark.
No, totally. I mean, if people had to decide for themselves based on the information out there, it's too contradictory. It's too
Absolutely,
difficult.
yeah, yeah,
And that's why by having these kind of discussions, we just want to plant the seed that, there are two sides to this. Don't just take it for granted that it's all as you normally would hear.
yeah.
And you are perfect in cutting through all of that anyway and just saying, look, guys, just eat the real food and let that tell you the answer, which is a very important approach.
In the beginning, I was like, do your own research. It's like, I saw these studies that says cholesterol. Okay, why don't you do your own study? Eat like this for a while, and then go and have your cholesterol level tested. And then eventually, okay, you're right. Come on, how can you say that all this human food that have been eaten for, forever,
Yeah.
you actually say that they're actually all of a sudden bad for you, but
Yeah.
you can eat ultra processed foods that Kellogg's have made. That's crazy.
Yeah.
That's actually crazy.
I know. And hopefully things are changing. Like what you're doing is really changing things, and so we're so excited to have you with us
Oh,
this
good.
year.
No, honestly, I'm I'm really looking forward to attending this. I think it's going to be good. I mean, we got the followers. I've got just now. You see comments from people from India, people from all over the world, and it's amazing. It really is amazing. Like South Africa, Mexico, there, and it's just simple. It's as simple as that.
Yeah,
Nutrition is simple. They've been the food our ancestors were eating for years and for years and years and years. They were telling us that, oh, they're all of a sudden they're not good for us. But then at the same time, 1 in 2 of us will get cancer, and then it's just crazy. And we're not making the, And somebody always says, Eddie, people live longer now. What's the point of living longer when you're on 200 medications and you can't even wipe your own backside? I was a nurse and I saw that,
yeah,
and
yeah. I mean, people think that we have longer lifespans now, but we don't. We have much shorter health spans.
I know.
And if you take into account, the kind of early deaths in the olden days, it makes it look like people weren't living very long. But if they got past a certain age, they did live a long time because they were eating the
Yeah,
right things. So you
absolutely,
can't
yes.
just look at the average lifespan. That's not telling you the whole story. And right now we have we are the sickest our species has ever been.
Ever been? I
And
know, and it's all because of profit, all because of all this stuff. Honestly, you go to we're on the high street, and you go Wenzel's, and you go Greg's, and you go all these
yeah,
ultra processed stuff. It's crazy, and there's a queue every single day.
yeah,
There's a queue.
yeah,
It doesn't make any sense.
yeah. Absolutely. And we really hope that people will, if they believe in Eddie's mission, then they will definitely believe in our mission. So if you can support us, and you said, Ed, you've got followers from all over the world, you can live stream into our conference in May as well, if you're not
Absolutely,
able to come along in
100%. I'll
person.
do
So
that
please try
because,
and do that.
and I'll do another live with you again. Okay,
Yeah, that'd be great. That would be fantastic.
Olivia, take care. Yeah.
Thank you, Eddie. And we look forward to seeing you in May and seeing you again on Instagram. So have
Yes,
a great day.
absolutely. Bye bye.
Thanks,
Have a
guys.
good day. Bye bye.
Bye.
Bye bye.